Uterine polyp. Uterine polyp is a very common problem that is faced in the reproductive age group in females. So basically everybody is worried the moment you get a scan report and you see that it has got a uterine polyp, you become worried about it. But basically you have to see what kind of uterine polyp is it. First and foremost, the size of the uterine polyp, whether it is too big or not. If it is more than 2 mm, it is more than 5 mm, 2 to 5 mm is borderline. If it's more than 5 mm, you definitely need to get it operated. But if it is less than 2 mm, you can leave it as it is. Secondly, many times a small thickening is seen, but that is not a true actual polyp. These thickenings usually go away by hormones. When you have your periods, it regresses out. Fourthly, so you have to be very particular what kind of polyp is seen. The polyp may be a feeding polyp, means it may be having a vascular pedicle, it may be having a blood supply that is coming from up the uterine cavity. These kind of polyps, they need to be removed with a lot of caution when we do hysteroscopy, because there is a chance of lot of bleeding and the surgeon has to be very well aware of it and has to take proper precautions. Thirdly, the uterine cavity. The cavity is basically divided into several parts. If the polyp is towards the lower side, it's not involving the mid corpus area, the area where the baby is going to be kept, the fetus is, your embryos is going to be kept. If it's not involving that area, then definitely you don't need to get it removed. So you can ease off if the polyp is small, if it is not lying in your mid cavity or in the upper cavity, that means you can avoid the surgery, you will not be facing any complications. Max you will be having small spottings and bleedings, and that you become comfortable with. This information is being given to you because it is very essential that whenever you undergo an IVF cycle, you should know about all the pros and cons of it. We are giving you this information because of that. Please be with us, we care about you.